Good day, everyone. We are now going to conduct our upcoming webinar on the importance of the treatment of energy imbalances and chakras energy replacement for prevention and treatment of cancer, which is going to be taken by Dr. Huang Ling. Hi, Dr. Huang, and we warmly welcome you for our continuous sessions that are being conducted since a month or so. So far, this is our fourth webinar, and it's all going very successful. Before we get into the talk, I'll have a small introduction of Dr. Huang Weiling. Dr. Huang Weiling is born in Taiwan, raised and graduated in medicine in Brazil, specialist in infectious and parasitic diseases, a general practitioner, and parenteral and enteral medical nutrition therapist. Once in charge of the hospital infection control service of the city of Franco's General Hospital, she was responsible for the control of all prescribed antimicrobial medication and received an award for the best paper presented at the Brazilian Hospital Infection Control Congress in 1998. Since 1997, she works with the approach and treatment of all chronic diseases in a holistic way, with treatment guided through the teachings of traditional Chinese medicine and Hippocrates. Researcher in the University of Sao Paulo in the ophthalmology department from 2012 to 2013, and she has been continuously collaborated with the Enliven archive and us, and she delivered beautiful lectures on energy alterations and chakras energy deficiencies and propensity to coronavirus infection, the importance of correcting energy imbalances in the prevention and treatment of myocardial infarction, and energy alterations as the underlying cause of primary hypertension. And current topic, which is going to be dealing with the prevention and treatment of cancer. I heartily welcome Dr. Huang Weiling for the upcoming session, and I welcome all the attendees who have come all the way to participate in the session. Dr. Huang, please go ahead with the session.
Thank you, Kumar. Hi, good morning to everyone. I know it is afternoon in India and all in other countries. Thank you for the introduction, Kumar. My presentation today is entitled The Importance of Treating Energy Imbalances and Chakra Replenishment for Prevention and Treatment of Cancer. Analyzing this study we have in literature, they normally aim to give a supportive treatment for these kinds of patients who are undergoing cancer treatment using chemotherapy and or radiotherapy. All of them aim to control nausea, vomiting, depression, loss of appetite, etc. But this presentation I'll give you today is different from what we have in literature, for I will approach the pathology of cancer from the energy point of view, not treating only the symptoms as the cancer itself, but the patient as a whole, observing the influence of the energy imbalances on the cancer development. For you to understand a little better the way of thinking proposed of this study and the other studies of mine, I'd like to start by describing the case that originated the theory that guides the proposition of diagnosis and treatment. This is a case I treated myself in 2007, and I will tell you now. The patient in question had a leg pain in both legs. When he first reached to me, for the pain would not go away with the use of anti-inflammatory medications. And the patient also informed me to feel cold in the lower limbs. According to traditional Chinese medicine, the patient was diagnosed with kidney iron deficiency. And first, I performed the physical exams and questionnaire to diagnose his energy deficiencies and to treat this energy imbalance We start with the use of Chinese dietary counseling, auricular acupuncture, and systemic acupuncture, and and the apex ear bloodletting. The patient was normally treated with the described procedure and recovered from the pain in the legs. 10 acupuncture sessions later, he returned for reevaluation and told me he also had great improvement of his glaucoma condition. But I was not aware the patient had glaucoma when I treated him. The patient was performing the conventional treatment with the eye drops for more than 40 years with only little success. However, his ophthalmologist confirmed that his intraocular pressure suffered a reduction from 40 mmHg to 17 mmHg after he was treated with Chinese dietary counseling, auricular acupuncture, and systemic acupuncture with apex ear bloodletting. I was much impressed with this result and I sought to study as a researcher at Brazil Best Medical College, the São Paulo University in the ophthalmology department of the glaucoma section, exploring and demonstrating the effect of acupuncture in glaucoma patients. Based on this observation, this study was presented for the first time in 2007 at the American Congress of Acupuncture in Baltimore, United States, and in 2015 it was represented with another title, Acupuncture Viewed Holistically Can Treat All Symptoms and Disease at the Same Time at the Acupuncture Research Conference at the Harvard Medical School. In this presentation, I emphasize the need to treat the patient holistically, treating the yin-yang blood energy imbalances, and by rebalancing these energies, we are able to treat all the patient's physical and emotional symptoms in the different pathologies at the same time. Today's presentation, we will explore this reasoning in cancer patients. To better explain my reasoning, I always like to use the metaphor of the tree. I use this metaphor to make a comparison of Western medicine from ancient medicine, such as traditional Chinese medicine. On this slide, we can see the root of the tree, the trunk, and the branches and the leaves coming out from each branch. In this representation, each medical specialty is represented by each branch, and the leaves of each branch represent the symptoms and disease related to each specialty. Now, I will describe 3 case reports to you to understand how was the treatment done in this patient and the results. Now I will describe the first case report. This patient was treated in November 2018. An NMAG, a 70-year-old woman, did a routine gynecological exam and the doctor requested a thyroid exam. On the result, it was found that the patient had 3 malignant tumors on the thyroid. The biggest one was 14 centimeters, and the patient was submitted to biopsy, which confirms the diagnosis of malignancy. She was then taken into another specialist on disease of head and neck, which requests an urgent surgery to take out all the thyroid and do the iodotherapy and chemotherapy afterwards. She started treatment with levothyroxine, and stressed out by her recent diagnosis, the patient sought my clinic again after a long time I had previously done acupuncture treatment on her. And she also had diabetes, hypertension, and diabetic retinopathy. Once she came back, I diagnosed her according to TCM with yin deficiency and heat retention. Based on traditional Chinese medicine reasoning, I oriented her to take out of her diet all dairy products, avoid cold liquids, raw foods, and sweets. And besides, I also orientate her to avoid fried foods, chocolate, eggs, honey, and melted cheese, and coconut and alcoholic beverages too. And the coffee, matcha tea, and soda was also to be avoided too. Her treatment also included auricular acupuncture with apex ear bloodletting procedure. And she was also submitted to the radiesthesia procedure to analyze the level of the patient's chakras energy. Radiesthesia is the science of using the vibrational fields of the human body to access information about other objects of animate or inanimate nature by establishing resonance with their energy fields using specially calibrated instruments and a scale of qualitative measurement to decode this information. The dowsing method was used with a crystal pendulum in front of each chakra, and depending on the movement of the crystal clockwise or counterclockwise, or the crystal's rotation amplitude, it is possible to evaluate the amount of energy that each chakra represents. All the patient chakra appeared were very much depleted, rate 1 out of 8. And here are 7 chakras. Here is the spiritual chakra, the 7. Here is the 6 responsible for the memory and the concentration. Here is the 5th chakra responsible for the digestive system. Here is the 4th chakra, and the organ that is responsible for him is the lung. Here is the 3rd chakra. The organ that is responsible is the heart, according to traditional Chinese medicine. And the 2nd chakra is ruled by the kidney energy, and the 1st chakra is ruled by the liver energy. And the patient underwent the acupuncture sessions every day, as well as following the diet and maintaining the use of crystal-based medication and homeopathy to replenish the energy of the chakras. After 3 months of treatment, it is possible to perceive diminution of the tumor on the naked eye, and the patient reported to feel better emotionally and physically, feeling stronger. As she had the surgery scheduled. It was requested for the patient to repeat the exams, and the surgeon did a freezing biopsy during surgery, and as a result, it was discovered that the tumor had to turn benign. The exam showed reduction of one tumor from 14 centimeters to 4.5 centimeters, and from the other 2 tumors, one had disappeared completely. And after this discovery, the patient did not need to do chemotherapy or iodotherapy anymore. And the thyroid of the patient that needed to be completely removed at first was now normally functioning, not needing to be taken out surgically. Now I will describe the second case report. A 38 years old female patient came to my clinic after having an exam showing atypical cellular results in a pap smear exam. And the patient was frightened by the idea of cancer. In Chinese medicine, her diagnosis was yin, deficiency of yin and qi blood, and heat retention. Her treatment consisted in Chinese dietary counseling, as the same in the first case, acupuncture, and auricular acupuncture with apex ear bloodletting procedure. The patient's chakra was also measured through the radiesthesia procedure, and they were all rated 1 out of 8, all her chakras. And with the exception of her 7th chakra, that is the spiritual chakra, was normal. Homeopathy and crystal-based medication for the replenishment of the energy of the chakra were also prescribed. And within a few sessions of treatment, the patient was able to normalize her exams and the atypical cells disappear completely. Now, for our third and last case, we will talk about a 42-year-old man undergoing treatment for lung cancer and being medicated with chemotherapy. Even in the treatment, the patient had metastases in the brain and other parts of the body, being even able to touch externally a metastatic tumor on his abdominal wall and several cervical ganglions. Neurosurgery was performed to remove the brain tumor, and his oncologist continued with the chemotherapy process, which was not reducing metastatic tumors. This patient was being treated out of town and he stopped seeing me when his cancer treatment began. After a while, he came back seeking for my help. Since the first consultation, the radiesthesia procedure had shown its complete weakness on the chakra center, all rating 1 out of 8, with the exception of his 7th spiritual chakra. And the same treatment as of the previous patient was prescribed, starting with Chinese dietary counseling, auricular acupuncture with apex ear bloodletting, moxibustion, and homeopathy and crystal-based medication, all with the goal to replenish the weakened chakra energy. After undergoing traditional Chinese medicine prescribed treatment, the patient had an incredible improvement in his dyspnea. There was a disappearance of all metastases and all the lung tumors itself. With the improvement in his health, the patient also had an overall improvement both physically and psychologically, even though he was still undergoing certain chemotherapy treatments. After 2 years of TCM treatment, the patient was happy to be healthy enough to have his girlfriend pregnant. The diagnosis and treatment of Western medicine is focused on the leaves level. Therefore, the treatment is focused on the patient's tumor. In traditional Chinese medicine, various symptoms of different specialties can be treated at the same time, as observed in the glaucoma patient I mentioned at the beginning of this presentation. The energy imbalances of the metaphor are placed as the root represented by the 5 elements and yin and yang theory. To be healthy, we aim for a state of equilibrium between yin and yang energy, and if there are imbalances between these two energies, symptoms occur, and if not properly treated, it consolidates the disease in the future, and in this case, cancer. Yin and yang are energy forces that rule the world. Everything in the universe is composed of yin and yang, including our human bodies. The symmetrical arrangement of the dark yin and the light yang is not static, as we can see in the symbol. It's a rotational symmetry that suggests a continuous cyclic movement. Specifically, yin and yang imbalance and disequilibrium occurs in tumor patients. The weakness of yang is universal in patients, which suggests blockage of the normal energy metabolism, diminished or even stagnant energy status. From the perspective of traditional Chinese medicine, cancer is the manifestation of the underlying imbalance of these energies in yang blood, and a tumor is the uppermost branch of the illness, but not the root. Each cancer patient may have different imbalances of these energies causing the same type of cancer. The imbalance between these four energies will lead to a fourth imbalance, which is the formation of internal heat. The patient who has internal heat manifested clinically has bad breath, bleeding gums, red skin lesions, acne-like, abdominal pain, microscopic hematuria may be an indirect indication of clinical predisposition of cancer development in the future, or the patient may already have it, as this may be a clinical indication that the patient is deficient in energy, which is in TCM is the cause of cancer formation, the deficiency of energy associated with the heat retention. Compared to Western medicine, Chinese medicine considers the root cause of tumorigenesis is the decline of the immunity due to energy deficiency, which all case studies presented today had in common: the complete lack of energy in the chakras measured by radiesthesia. And to diagnose the energy imbalances, I usually ask my patients several strategically questions. Oh, here. If the patient feels constipation, this means that the bowel does not have a normal bowel movement every day. This means blood deficiency. If the patient feels hot flashes, this means insufficiency. If the patient feels cold at the extremities, this means yang deficiency. And if the patient has sweating during daytime, this means qi deficiency. When the patient feels sweating during the night when he's sleeping, this is a sign of yin deficiency. If the patient feels dry mouth, bad breath, gingivitis, bleeding gums, dermatitis, itchiness, abdominal pain, and microscopic hematuria, all these are signs of heat retention that are indirect signs that the patient could have cancer or other disease that can induce by this disharmony in the future, or he can present cancer at the time of the diagnosis. Besides yin and yang, there is another theory that is also bases traditional Chinese medicine teaching, which is the five element theory. And the elements are wood, fire, earth, metal, and water, and they are interconnected, not isolated as Western medicine reasoning think. Each this theory states that in the human body, each of these elements represent an organ, and each organ is responsible for an external sensory organ. Each of these internal organs is the source of energy for their functioning, as well as their corresponding external sensory organ. This system of energy is interlinked, and the influence of one element or one organ on the other is dynamic, not fixed or isolated. The wood element corresponds to the liver and has the eye as its external sensory organ, being responsible for vision. The fire element corresponds to the heart and represents the tongue and subsequent language. The earth element corresponds to the spleen and represents the mouth and is responsible for taste. The air element corresponds to the lung represents the nose and is responsible for a sense of smell. And the water element corresponds to the kidney and represents the ears and is responsible for hearing. The reason for explaining all this is so that they can understand that all internal organs, according to traditional Chinese medicine, are interconnected, and the deficiency of one organ can cause the deficiency of all the other organs according to the cycle of generation and control of the five elements. And the chakra and the five element theory are correspondents. This topic is the main reason for this presentation because according to traditional Chinese medicine, energy deficiency is responsible for the formation of tumors. And if we find that the chakras are without energy, which actually corresponds to the lack of energy of the organs in TCM, if we start to recharge these people's energy, they are less likely to develop cancer because the energy corresponding to our immune system will be working. Any patient diagnosed with cancer, the treatment of this lack of energy may serve as an adjunct of the chemotherapy treatment that the patient is already undergoing. As in the case study patient example, the metastasis and the size of the patient's tumor has only been reduced or disappeared completely with this treatment of rebalancing the internal energies and replenishing of the chakras energy. So, in addition to all the guidelines made by Western medicine in terms of correcting the diet and readjusting the lifestyle to avoid or improve the treatment of cancer patients, from an energy point of view, we must avoid all situations that lead to energy deficiencies. And in this study, the reason why I treated my patient only with high diluted medications are trying to minimize the use of high concentrated medications as much as possible is based on the Arndt-Schultz law. According to this law, the use of high concentrated medications leads to a deficiency of the vital energy, which in cancer patients is already very low. And the use of high diluted medications is highly recommended, such as homeopathy medication. And in this type of patient, as it improves their vital energy, thus improving their immunity, leading to the reduction or less formation of tumor process by itself. I want to show you that the use of homeopathy is not the normal homeopathy theory. It's a theory created by me by treating this chakras energy, and we are treating the root of the problem. These homeopathic medications, they are published in another publication that's not here yet because they are in process of publication, and it is related to a title, Constitutional Homeopathy of the Five Elements based on traditional Chinese medicine, where I demonstrate how this theory was created and how we can use this theory to replenish the chakras energy. And I didn't put the publication yet because it's not ready. It will be ready until the end of this month. And you can access by internet directly to read this publication too. Here we can see I'm proposing the need to be integrating the teachings of traditional Chinese medicine and Western medicine in cancer patients, since the treatment of energy imbalances is very important for the recovery of the physical, mental, and emotional symptoms of cancer patients. And treating the cancer, rebalancing this energy, treating, we can treat cancer as demonstrated in the first and the second case report, or giving more supportive of energy in the cancer patient that is already treating with chemotherapy, radiotherapy, because this kind of patient may have less metastasis, and the patient will be more fortified when you treat the energy imbalances and reducing the rate of the incidence of metastasis or the relapses of cancer or the formation of cancer in another site or another location of the body. And the conclusion of this study is that it is very important to treat the cancer at the energy level in each patient, as cancer is seen as a result of the patient's energy deficiency. The recharging of the chakras energy is important to their treatment or even cure of this pathology based on these three case reports presented in this study. A bigger and more comprehensive study should be done involving more patients with different sets of tumors and cancers, to the goal of exploring, improving, or complementing the worldwide treatment of cancer in a holistic way. As said by Hippocrates, foolish the doctor who despises the knowledge acquired by the ancients. And thank you for your attention. My email is on this slide. If you have any doubts or if you want to perform another question, you can mail me and I will be happy to reply to you. Thank you.
Thanks a lot, Dr. Huang. That was a very insightful presentation, as you always take very beautiful presentations. And yeah, when it comes to cancer, mainly people will be very much scared about the treatment and also the consequences what they'll have to go through after the treatment happens, because both the physical and mental ability will be lost once they have undergone through the cancer treatment. And by balancing these energy chakras we can do a lot of wonders. Usually I would like to actually inform all the attendees that Dr. Huang does treatment or does curations in a very unusual thing. Actually that is not very unusual. It is our traditional medicine, but people have forgot everything what about our olden days were. And that is a problem. We both are have been collaborating together to get the olden days back. And that was so beautiful to go through all the systematic case studies what you have gone through in the treatment of cancer patients. And yes, if attendees are having any few or any doubts, they can actually raise their questions either in the chat option or question option, or they can also raise their hand so that they can interact with the speaker then and there. And Dr. Huang, in this particular short option today, in spite of getting queries, many are being sending you a lot of appreciations, like very nice presentation, good presentation, very fruitful session, and
Thank you.
yeah, so many appreciations today. And
Oh,
yes, yeah. And I also want to let you know that we will be having one more presentation on next Saturday at 3:30, which will be on diabetic patients. The topic will be, why are diabetic patients still having hyperglycemia despite diet regulation, anti-glycemic medication, and insulin. This is very important. Today, diabetes has become a very normal disease for everyone. Out of 10 members, 9 members are suffering from diabetes, and they are being affected with the many side effects of the medicine, and they couldn't able to follow the diet properly. If they can correct their chakras with this energy treatment, then obviously they can also have their health in their hands. So if you want to add any few words to this, please go ahead, Dr. Huang.
Uh, do they have any questions? No?
There are no questions today. There are a lot of appreciations. You can also see claps and likes on your screen.
Oh, thank you, thank you.
And there is a
Um,
question now.
yeah, I would like to say again that it's very important to see the patient as a whole and treating not only the symptoms of the patient, but to treat what we can't see by the naked eye, that's the energy. And if we only treat the symptoms but not the root of the problem, the patient will not improve of his disease, and you will not have chance to cure the patient. And you see, the treatment is not very, it's simple. You need to understand what is under, what's behind that sentence, to you to understand what you need to do. Correcting the diet, as said by Hippocrates, diet is you need to use the food as your medicine your food. This is the first principle, that you need to change the diet of the patient, mainly cancer patient. The food that is more important to take out is the dairy products. Dairy products are the main cause of cancer in traditional Chinese medicine. And I know in India you don't use they don't eat cow's meat, but I don't know if you use the dairy products or the milk.
We
But I
use.
think, yeah, they use or not.
We use.
Yeah, it's important to change this milk or take out all kinds of milk. The how can I say, the cheap milk you can use,
Okay.
or the soy, but not the cow's milk. And
Okay.
because the formation of tumor is related to the retention of phlegm, and phlegm is related to the spleen pancreas deficiency, and it's not caused by the dairy products consumption, but by the consumption of the many raw food or cold water. And that's why in China they usually drink warm water. In all the places you in China, they drink only water at 32 degrees temperature, to not imbalance the internal energy that can cause some disease in the future, like diabetes, cancer, etc.
Yeah. There is a question from the audience.
Okay.
Dr. Yadav, who is Faculty of Environmental Studies and Jesus and Mary College and University of Delhi, he posted a question stating, maybe there are side effects in homeopathy system of medicine. So he's asking whether you are just treating with homeopathy system or any other things are involved in your system other than homeopathy.
No, the to replenish the chakras, I use the homeopathy medication because of that law and Schultz law. If you use high concentrated medication, you will worse even more the vital energy that is already low in this kind of patient. And if you can take out this high concentrated medication and use only high diluted medication, it is better for the patient because it's the side effects of this medication is quite zero if you prescribe the right medication. And for all kinds of the situation, I try to use only Chinese dietary counseling, changing the diet, use acupuncture to rebalance the internal energy, and recharge the chakras using uh, high diluted medications such as homeopathy and that crystal based medication. Each stone has the power to replenish the energy of each chakra too. And that's why the patient, if you only do this treatment for the majority of the patient, he will improve for all kinds of disease and symptoms at the same time. You don't need to prescribe any other kind of medication. Even I will have one study to show you in the future. I think I will, because I can treat community infection and hospital infections, and I can treat them only using this kind of reasoning without using any antibiotics. And I'm infectious disease specialist, and since I I use antibiotics for the past 10 years, I use antibiotics for I think 3 patients only. The majority of the treatment were done only using this kind of treatment.
Okay, that's great. So yeah, people have to understand this. The single statement what Dr. Huang expresses in all her talks is curing a disease is not that important, but correcting the root is very important.
Yeah,
So
as
yeah,
a
please.
state by Hippocrates, if you don't know what the person has, and if you correct on the imbalances, as I told you, the patient that I had in 2006 of the glaucoma case, I didn't know that he has glaucoma, and he told me that he has only leg pain. And I treated the root of the problem, and all his diseases appear, even the glaucoma, the high intraocular pressure, normalized with the treatment. But I was not aware that he had the high intraocular pressure, and it decreased. And that is why I know that if you treat the root, you can improve all the symptoms, even if you don't know the patient has that disease or symptoms. This is very interesting and good for you, because you can treat all. Because in the first case report, the patient had diabetic obesity and diabetic retinopathy. And she improves all the, I didn't put in this presentation, but she improves from the diabetic retinopathy, the diabetes reduced, and she reduced the obesity too with the treatment, or rebalancing the energy, the internal energy.
Yes, exactly. So everyone have to have a special mention of this. And yeah, if I guess there are no more questions from the audience, and if you have any more points to discuss, we'll go ahead, or else I'll just wind up the session.
Yeah, I think this kind of treatment is, yeah, we need to use this treatment in the present now today, and in the future, because the for the cancer patients treatment today, the use of chemotherapy and all these kind of treatment, they are important too, but they are harming the vital energy of the patient. And you need to give the support to the patient, because most of them have depression, anemia, and hair loss, and so many complications that is more complicated than the cancer itself.
Yes.
Okay. Okay.
Exactly. Yeah. Okay. Okay, Dr. Huang, that was a very nice thing to actually share with all of us. And I guess this will be circulated to more members through recorded versions. And yes, we also have a forthcoming, webinar which is going to be on why all diabetic patients still have hyperglycemic despite diet regulation, anti-glycemic medication, and insulin. So I guess every other attendees will also have their presence over there. And there is a appreciation again. Thanks, Dr. Huang Weiling, for excellent and highly informative session. Congratulations to me for conducting this wonderful webinar.
Yeah. Thank you, Kumar. You are very
Thank you.
good.
Thanks a lot. Thanks a lot for that lovely appreciation, Dr. Yadav. Yeah. So, okay, they will just wind up the session. I always thank Dr. Huang Weiling for all the time she takes to, improvise our current society, and also thank all the attendees who have taken their time to attend the webinar. Thank you. Thanks a lot. I'm ending the session.
Hi, thank you, and see you for the next Saturday for the next webinar. Okay, of
Okay.
this
Thank
presentation.
you.
Bye bye. Have a
Bye.
nice weekend. Bye
You. Bye.
bye.